I feel is the best drug in this category. Most controversial thing, ARBs and eGFR, CKD. Into few updates if you want. Hi everyone, this is Dr. Vishweshwaran from Jayanti Hospital. So now, as episode 1 of a clinical series, we are starting with the best drug in the category. Category is ARBs under antihypertensives. So now, as you know, there are many drugs like Olmesartan, Valsartan, Telmisartan, Cardiovascular, and new Receptor. So many drugs are there. So now this is basically like we don't talk about physiology or pharmacology. Like I want to put it as a disclaimer that this will be only for practical purposes and like not though so much theoretical. This is not for tertiary care centers, people who work with these evidence-based medicine researchers, new drug they play with. Okay, this for practical purpose. So basically, ARBs, as you know, they help in vasodilatation and decreases sodium and water retention and aldosterone activity, and definitely lowers this intraglomerular pressure. So basically, the indications, as you know, we can use in diabetic nephropathy, albuminuria, other causes of proteinuria, and heart failure, where this AC inhibitors are not tolerated, or cough and angioedema, which is not that uncommon, is there. So, and definitely, as you know, people more 55 years, this is the first line of drug under many scenarios. It is advised. So, coming to where not to use, though it is a drug of choice for unilateral renal artery stenosis, if not used in bilateral renal artery stenosis and pregnancy. And this point, I'd like to emphasize that this point is the take-home message of this today's video. So, whenever there is more than 30% rise in creatinine level, or there is hyperkalemia, so just these two things. Okay, hyperkalemia increased in 30% rise in creatinine levels. So we won't use or we should discontinue a temporary food at least. Okay, so now individual drugs like as you know, Valsartan, Intern, mostly they are used in heart failure, though like we don't prefer as ACs are going good. So if you want an alternative, you can use this drug. And coming to a very commonly available drug, Losartan. Losartan is easily available in government setup. It's a bit cheap and widely used. But thing is like its half-life is very less than even 12 hours, and it is useful in patients with hyperuricemia. So you should select the patient's profile to use Losartan. And coming to Olmesartan, so this is the most potent drug in this category. So coming to Olmesartan, so this is the most potent drug in this category. Means it decreases BP the most than any other drugs in this class. It's a bit costlier, so we can use this if our only target is decreasing the BP. Mostly that only decreasing the BP, I meant mostly that may not be the scenario. Coming to the drug which everyone uses so commonly, and I feel is the best drug in this category. So I will use this drug like first line, Telmisartan. Why? Telmisartan basically is having longer half-life, like around 24 hours. So basically you can start with OD dosage. Sometimes you can use BDs also. And it is having PPAR gamma reduction activity, which is very important for increasing the insulin sensitivity. And it also helps in decreasing triglycerides, we have told.